Preview.
Altitude Illness in the Andes by Marty McCafferty. Two American college students in their 20s were backpacking in the Bolivian Andes. They were experienced hikers, but had not backpacked internationally before. Both travelers were in good health and exercised regularly. They were near the town of Cochabamba, southeast of Bolivia's capital, La Paz. They ascended from an altitude of about 9,000 feet above sea level to 13,000 feet in the first 48 hours of their hike. The following morning, one of the men began experiencing disorientation and difficulty breathing. He had complained of a persistent headache, fatigue, and nausea since arriving at the initial altitude, but the confusion and respiratory distress were new and very concerning to both. So they descended for medical evaluation at a local clinic. The local doctor was very familiar with altitude-related illnesses and suspected acute mountain sickness. Upon examination, the doctor confirmed fluid in the young man's lungs, pulmonary edema. In addition, there was also impaired coordination and concentration, and this indicated that cerebral edema, or fluid around the brain, might be an additional complication. These various findings not only confirmed altitude illness, but one of the most severe forms of it, high-altitude pulmonary edema and high-altitude cerebral edema. The doctor started treatment on oxygen and the necessary medications. The patient did improve, but only slightly. Oxygen and other medications are important elements in the treatment of mountain sickness, and it can delay worsening of the condition. Definitive treatment, however, is prompt evacuation to lower elevations. Because it was so serious, this patient needed hospital care. There were nearby hospitals, but they weren't at lower altitudes than the present clinic. Therefore, both the patient and traveling companion contacted Dan to seek assistance. Dan medics obtained a thorough medical report from the doctor and quickly determined the patient needed evacuation. Dan's physicians worked with the evacuation companies and started looking for appropriate facilities below an altitude of 5,000 feet. Finding facilities with these criteria, it was possible to move the patient within 24 hours. The appropriate hospital was found in Santiago, Chile, about 1,500 kilometers from Cochabamba. The evacuation would require a jet and sufficient range to travel that distance without refueling. An air ambulance would also provide a medical team. The evacuation was a challenge. Amongst other complications, the provider could not land at the nearest airfield as the runway was too short. So they had to use a twin turbopropeller plane to fly to the nearby airfield and then to a subsequent runway where the jet could land. The patient was successfully transferred to the hospital in Santiago, and there was no deterioration. Hospitalization lasted for the next week, and he made a complete recovery. Divers, in general, are well versed with diving-related injuries, and most also investigate the tropical diseases when traveling to areas where there's risk. But there are other travel-related illnesses, of which mountain sickness is one. Though most divers are familiar with the risks of flying or ascending to altitude after diving, altitude in and of itself may be sufficient to cause illness. The most common early symptom of acute mountain sickness is headache. If the individual remains at altitude, lethargy, malaise, and more serious symptoms may follow. Some symptoms of acute mountain sickness are amongst the symptoms also observed with decompression sickness, and if there was exposure to diving and altitude, both may exist around the same time. The chances of developing acute mountain sickness is also a gamble. There are identifiable risk factors, but it is largely a matter of odds. Previous experience does not always determine future risk. An individual may be unaffected on some ascents and be incapacitated during others. Traveling divers should not be discouraged from participating in excursions to higher altitude, but they should consider the unique hazards and take appropriate precautions when exploring these regions.